Hello everybody, my name is Dr. Mohammed Tukir Ahmed. The topic for today's video is pigmentation. What I would like to do today is just give you a brief synopsis and overview on pigmentation, maybe the causes that are involved, some of the treatments and the realistic outcomes to expect. It is quite a vast topic, so there will be further videos on each of the subjects one by one discussing them in further detail. But just on a short note to give you an overview, hyperpigmentation is caused by an excessive production of melanin. Melanin is responsible for giving the colour in our skin, and it's produced by cells that are called melanocytes. And depending on the amount of melanin that you have in your skin, depends your skin type. Skin type 1 is very milky skin, fair white with ginger hair, and skin type 6 is your darker Afro-Caribbean hair, skin types with short black hair. In between we have skin types 2, 3, 4, 5 and 6, and this is where the doctors will use their skills to decide and assess which treatment is suitable for yourselves. Hyperpigmentation itself is associated with multiple factors such as hormonal changes, UV exposure, trauma to the skin. Now that could be physical trauma like a cut, it could be thermal trauma from an injury, from a heat, from a laser, any type of trauma to the skin. Iron deficiency, there are multiple factors out there that can all result in hyperpigmentation of the skin. And more commonly here, the biggest, I think, single biggest trigger is UV exposure. And that's not just sunlight, that's exposure to UV lights at home, computer screens. The way we live and the way we work now is entirely different from a generation ago. And some of the conditions that affect us now reflect that. In pigmentation, there are two main types of pigmentation. There's what we call superficial pigmentation, which is in the upper layer of the skin, known as the epidermis. And then we have the deeper pigmentation, which is in the deeper layer of the skin, known as the dermis. So that's the two aspects. So there's epidermal pigmentation and then there's dermal pigmentation. And both have different requirements to be treated. When we are treating you, we try to formulate programs that will do three things. 1, to treat the epidermal pigmentation. 2, to treat the dermal pigmentation. And 3, to regulate the melanocytes. These are the cells that are producing melanin, which is now going on to hyperproduction. So to achieve a successful treatment program, which will give you results in the longer term, we suggest a treatment program that involves all three aspects of this treatment. Epidermal pigmentation, the superficial pigmentation, that responds well to topical treatments, the topical medications, peels, lasers, whereas dermal hyperpigmentation requires a bit more of an intense treatment, usually in the form of a Q-switch laser and medication via mesotherapy, which is to penetrate the deeper layers of the skin. In addition to that, what we will do is we will infuse medicine into your skin, which hopefully will be absorbed by your melanocytes and will start to regulate their activity as well. Our treatment plan is evidence-based. There's scientific studies behind these treatments that are worked, and actually a lot of the scientific studies are great because they deal with the darker Asian skin as well, because which has a higher, the Asian and Afro-Caribbean skin does tend to have a higher problems with pigmentation because of the increased level of melanin that they have in their body. The program again involves performing a skin analysis scan, and consequently, we're able to have objective evidence on the level of pigmentation that you have in the skin, the level of changes, the layers of the skin that are affected. As your treatment progresses, we're able with now in London with the more advanced scans is to do a sequential analysis to see how successful we are, and you can actually have objective evidence of the results that that you're looking to do and the changes that are occurring behind the skin. Treatment does involve multiple sessions. There are between 6 to 9 sessions involved, and really, do not expect any great miracles before the 3rd or 4th session. This is what I say to patients. It does take 6 weeks for the changes to manifest itself. The skin cells that are the keratinocytes that are produced, the whole cycle is 6 weeks for a keratinocyte or any skin cell to be produced, rise to the surface and to be shed. So it takes about 6 weeks for the new changes to come through. Once your treatment is done, what we do recommend is a maintenance program where you're coming in for one session every 3 to 6 months just to keep the changes at bay. We can't stop the oxidative stresses, we can't stop the UV exposure, we can't change the additives in the food, and these things will gradually have a toll again. So as well as using a lovely home care regime, skin care regime, which involves optimizing your skin health, keeping the pigmented changes at bay, and providing nutrients, etc., and medicines that are required to keep your condition at bay. Come and visit us once in 3 to 6 months. It's like coming for a checkup. If you've got diabetes, if you've got hypertension, you turn up at 6 months, you have a review, and we keep the condition under control. Pigmentation is a vast topic, and what I would like to do is maybe talk about the causes and also the different treatments one by one and the effects that they have on the skin at the different layers. But that's a subject for different videos. So if you like what you hear, please subscribe to our YouTube channel and keep a watch out for further treatments on pigmentation. Thank you very much for joining us today.